My name is Triff Dorin-Gheorghe, and I have the honor to present to you the work entitled Implications of Correlations between Communication Stressors and Correlations between Anxiety and Mental Health. During the periodic medical checkup, workers from one high school, having 93 employees, and two middle schools with 34 and respectively 35 employees, receive a voluntary questionnaire that include the following: 1. Socio-demographic variables: age, length of employment in the unit, biological gender, type of residence. 2. 6 occupational stressors that score the worker's stress on a Likert type scale in 3 steps. On a perceived level of stress scored from very low means 1, to medium means 2, and to high means 3. Related to communication with colleagues, students, and their parents. These 3 are the following: verbal violence from other employees, verbal violence from some students, verbal violence from some parents, physical violence from some parents, difficult cooperation with some parents, difficult cooperation with some students. 3. The General Health Questionnaire, having 12 items on a 4-point Likert scale, is used as a screening instrument to detect mental health and psychiatric disorders and common psychological issues like anxiety, depression, and social dysfunction in non-clinical settings. 4. The personality traits on Gray behavior inhibition and activation system, BAS, namely anxiety, fun-seeking, drive, reward, responsiveness. The present study aimed to evaluate the level of stressor in school workers related to communication with students, colleagues, and parents, as well as the perceived level of negative reactions they have towards the workers in relation to the personality traits of the workers and social democratic indicators. In the educational environment, particularly in schools, communication is essential for the efficiency of the educational act. For teachers, stressors related to communication are mainly represented by tense interactions with students, with parents, with colleagues, and with the management department. It is known that along with the students, parents can influence the way they communicate with school staff. Stress perception in school workers can be moderated by their personality traits. It is known that behavior activation system, BAS, also called the START system, activates approach, motivation, regulates response to pleasant stimuli, goal achievements, and rewards. People with a high BAS are predominantly extroverted, impulsive, action-oriented. The behavioral inhibition system, BIS, also called the braking or threat avoidance system, is associated with anxiety, fear, and insecurity. It seems that individuals with a high BIS are more sensitive to criticism and avoid risks. It is also important to assess the mental state, anxiety, and well-being of the individual in assessing workplace stressors. Female workers predominate in all schools compared to males. In terms of age and length of employment in the school, workers in all 3 school units have an average age between 45 and 48 years and an average length of employment in the unit between 12 and 17 years, as is shown in Figure 1. In the 3 schools, the level of stressors ranges from low to medium, as is shown in Figure 2. Average value of personality traits dimension, BIS and BAS, in workers are similar in the 3 schools, as is shown in Figure 3. The levels of stressors related to communication between workers and students, parents of students, and other employees are generally low and do not differ significantly between teachers and workers in other departments, for example, auxiliary and non-teaching. Overall, workers in the non-teaching department have significantly higher stress level compared to workers in other departments in verbal violence from parents variable. The perception of stress related to communication with other workers is associated with the perception of stress given that communication with parents, even with physical violence from them, is unrelated to personality traits of Gray's behavior inhibition and activation systems. Although the number of respondents is not large, the consistent results obtained in all 3 schools draw attention to the importance of the results obtained. Anxiety as a personality trait is associated with affecting the state of health, mental health, and psychiatric disorders, without this being constantly associated with perceived stress as a result of communication difficulties with students, their parents, and other employees. Among school workers, although anxiety levels are not high, their association with mental health disorders show the importance of informing workers about this issue and managing anxiety-generating situations. In the total group of respondents from 3 schools, there are significant differences between the variables studied by department as follows. Age workers in the non-teaching department have the oldest age, with an average of 55 years, compared to workers in the teaching department with an average value of 45 years. Verbal violence from some parents has the highest value among workers in the non-teaching department with an average of score of 2.17 compared to workers in the auxiliary department who have the lowest value, average value of 1.17 score. There are numerous correlations between the variables studied, different according to the school unit. However, similar correlations also appear in all 3 schools, which suggests a tendency to generalize these results. In all 3 schools, there are positive correlations between occupational stressors as follows. Verbal violence from other employees correlates with verbal violence from some parents and with physical violence from some parents. Verbal violence from some parents correlates with difficult cooperation with some parents and with difficult cooperation with some students. Verbal violence from some students correlates with difficult cooperation with some students. In all 3 schools, GHQ correlates with anxiety, BIS.